Yeah. See, it is called Chininam Ars, China Ars, both are same. So let's not have any confusion regarding that. Okay. And one very important thing you need to realize is it is a beautiful combination of China and arsenic. Aita? See, that's what I also explained you. Ki when you have China, meaning in your repertorial totality, you are getting China, and if the patient who is sitting in front of you is very restless, is very anxious, and there's a lot of anticipation, you also get a picture of arsenic. You also get a picture of arsenic. That is when you can think of China Ars. Okay? Beautiful remedy. I shared my own case, how nicely a single dose of China Ars cured my fever. Okay? And before China Ars, I was given arsenic. If I am right, I was also given Stephisagre. I am not very sure what my wife gave. But every remedy, after taking every homeopathic remedy, fever would promptly come back. Okay, and I was forced to take Dolo 650. But after China Ars, that episodes literally stopped. Weakness was better, appetite was better. In general, generals were better. Okay, so after China Ars, we'll start with a brand new remedy. I'll just share the remedy. Okay, so what I was trying to tell you is, okay, so now I'll just share a small case. This is what we have been doing. As a final year student, more of cases, more of practical orientation will make the class interesting, and of course, it will give you a lot of confidence what homeopathy can do. Okay, so few days back we had a gentleman around 66 or 67 years old man with left lung pleural effusion. The entire left lung, there was it was filled with fluid. Okay, I'll not go into the details of this particular case, but what I want to try to tell you is the remedy that I'm going to discuss today is a remedy which has predominant action on the lungs. See, when we analyze this case, the left lung and all, we have different way of analyzing. Okay. Now, what you have to ultimately realize is the remedy you prescribe should definitely have a pathology on, or should have a sphere of action on the lungs. That is what is very important. Okay. So, a simple question for you, for a final year student: what remedies, what remedies come to your mind when we talk of remedies acting on the respiratory tract? I thought you'll have a small question. I thought you'll ask me, sir, is it upper respiratory or is it lower respiratory? Okay. So, meaning, see, we can go systematic. There are remedies which predominantly affects the upper respiratory tract, and there are few remedies which affect only the lower respiratory tract. Okay. So what you need to understand is, when you look at a combination, there are many remedies which can affect both the upper and the lower respiratory tract. So now think of your remedies from your syllabus, out of syllabus, no issues. See, as a final year student, you will have that edge. What is that edge? You have both polycrest and you have rare remedies, both a combination. So can you quickly recall the remedies acting on the upper and lower respiratory tract? Okay, Allium Sipa, very good. As simple as Allium Sipa, Antimtard, Calicarb, Phosphorus, Drosera, Spongia, Ipecac, beautiful remedy, Ipecac. One simple remedy, a remedy of today's season. What is the season? The season is the weather has changed. Weather has changed from what? Cold to hot. Lot of patients are coming in now. Don't make the same mistake. See, when I did Dulcamara, I have told you when Dulcamara comes into picture. Now, what is the weather we are talking? When there is a change of weather from cold to hot. Okay. So now this is a beautiful season where the remedy that comes up is bryonia. Many we have in our clinics now, acute fevers, body pain, excess thirst, they just can't bear the heat, they drink cool drinks and all, and then they land up with respiratory infections, cold cough. The remedy is bryonia. Now when will dove camera come into picture? From summer. From summer. If it is going more into rainy season or a winter, that change of weather you can think of dove camera. Bryonia is also a beautiful remedy acting on lower and upper respiratory tract. Phosphorus, arsenic. Okay. Can I have some rare remedies as a final year student? Sticta, beautiful, good. One has got it right. Sticta is one remedy. You also have remedies like Senega. You also have remedies like Squilla, Corallium rubrum. Corallium is more of lower respiratory tract, but good. Corallium rubrum, few rare remedies. So today we will talk of a remedy. I mean, we'll, try to understand which remedy we are talking in few seconds. So the suspense surprise will go over. But what you need to understand is, from your pharmacy knowledge, I don't know if you can recall which plant I am going to discuss. I know it's difficult. Must be if you have shown me this picture day before yesterday, even it was difficult for me. Because only yesterday I prepared for this class. Okay. Now this remedy, I'll just give a small introduction. We'll see if this will connect to the remedy I am going to discuss today. Okay. See now, I was referring Clark, beautiful materia medica, Clark dictionary. Okay. And there in the introduction, Dr. Clark mentions, this is an ancient remedy. I mean, before we homeopaths proved it homeopathically, this remedy was used. Fine. So what was it used for? It was a domestic remedy. The herb, the plant was used for treating cold and cough. Okay. And it had a special affinity for lung tissue. And that's how its common name is called as lungwort. Now any idea which is the remedy which has a common name? Lungwort. A remedy which has common name lungwort. I know common names for a final year student is not very important. Okay. And it was introduced by Dr. Hale. Dr. Hale was the person who introduced this to homeopathy. And one he had actually told about this remedy, and the remedy we are going to discuss today in detail is Sticta pulmonaris. So Sticta pulmonaris is the remedy that we are going to discuss. Okay. And you have got a brief idea that the sphere of action of this particular remedy is predominantly on the respiratory tract. Fine? Okay. See, when I say respiratory tract, it is both upper and lower respiratory tract. Done? Hope I am clear. The first action. We will go very slow, very systematic, so that you will have no doubts left. Okay. So, the primary focus of Sticta, which even before we homeopaths proved it, it was clear that it acts on the upper and lower respiratory tract. That's first point. Second thing, what exactly does acting on the respiratory tract? See, all these days, whenever we spoke of dryness on the respiratory tract, the remedies that would come to our mind is bryonia. Very good. One more remedy. Okay, spongia also has dryness. Good. I have got nothing against spongia. One more remedy. More than phosphorus. Bray, and it is related. It's a complementary if you look at the relationship. Another remedy is alumina. Alumina also causes dryness. Must be somebody told it was not loud enough. Good. See, dryness. Okay. See, what I am trying to tell you is, see, that's where we miss remedies like Sticta. Because we are all so fascinated about bryonia. Once we see dryness, we think of bryonia. But today we will make an effort in understanding a beautiful remedy Sticta, so that we don't confuse it to bryonia, or we don't prescribe it instead of some other remedy. Okay. So first action is on the respiratory tract, and second, again, honestly, if you ask me what I remember about Sticta from my college knowledge way back is, I remember only this: sorry to tell that I had absolutely no idea about the respiratory tract. One area which was, so much told to us during our college days was its action on the joints. Okay, there is a beautiful, condition, and that condition we'll explore a little later. But housemaid's knee. There is a condition called as housemaid's knee. I'll tell you what it is. We'll try to understand. No issues. But this is one thing which was deeply rooted in my mind. Housemaid's knee, Sticta. Okay, fine. So on joints, especially the knee joints, it will cause inflammation. Okay, we'll go ahead and we'll see the last area, and that last area is, the nervous system or the mind. We'll discuss here. Two things you will see. One is chorea, and the other thing is hysteria. Chorea and hysteria. As a final year student, you study chorea in your medicine, and you would have studied hysteria in psychiatry. We'll discuss if time permits. Now this chart, this PPT is very important. The sphere of action of Sticta and what exactly Sticta does acting on the three areas. Any confusion here? No. We'll go ahead. Okay. We'll look at the second component. What are all the ailments? Okay. Yeah, I know the image has come up. Injuries. See, but the beauty of Sticta, whenever we say injuries, see now why I am repeatedly telling you this is, as a practitioner I know must be many cases I would have given arnica. Okay. And I don't want you budding homeopaths to make that mistake. You should have the clarity. Now in fall or in injury, when do we indicate Sticta? That is very important. Many times, I was just looking back, we would have had many patients in clinic. They generally come to you with pain in the knee, and the pain would have started after a fall. They would have fallen down, they would have hurt their knee, and then they come to you with knee pain. Okay. And many times we would have given arnica. Fine. But the only remedy mentioned in our Materia Medica, pain knees after fall, only remedy is Sticta. You are getting my point? Fine. But we generally prescribe, ladam, arnica, whichever injury remedies we know we prescribe. And that's why we fail. I repeat, that's why we fail. And it's not homeopathy that has failed. Because homeopathy never told what? Pain in knee after fall is arnica. Homeopathy did not tell. Fine. Homeopathy has told pain in knee after fall is Sticta. But we homeopaths generalize any pain and we give arnica and we make a mistake. Fine. So this is the clarity you budding homeopaths should have. Fine. So we'll go ahead and we'll try to understand. From the image, I am talking to you about hemorrhages. Fine. Ailments after hemorrhage. What is it? Ailments after hemorrhage. Ailments after blood loss. You have a lot of remedies. Again, arnica, fine. China, beautiful, good. Okay, a lot of remedies. But the challenge is what happens in Sticta after there is bleeding. Okay. For example, there is an injury, there is a bleeding, or the lady will have excess menses, menstrual flow. There's excess bleeding, hemorrhage. And then what happens in Sticta? What did you see under the nervous system? What was the action of Sticta? Chorea and hysteria. See, if there is hysteria or chorea after blood loss or after hemorrhage, the only remedy is Sticta. See the beauty of Sticta. For example, tomorrow you have a case, this lady is bleeding severely and then she acts hysterical. Okay. Now the remedy is Sticta. Fine. Now this is what you need to understand. So two very important ailments. One, ailments from fall, and because of fall in Sticta they will have knee complaints. And because of hemorrhages in Sticta they will have chorea or hysteria. Aste. Fine. I hope it's clear. Done. We'll go ahead. Fine. We'll look at the very important part of Sticta. Or I mean, before I go into the depth, I'll be focusing I'll be explaining Sticta under 4 important headings. Okay. One, will discuss about the mind. There are few nice symptoms I'll share. And second thing is, we'll be discussing the joint affections. Third, we'll have the respiratory. And the last, I was referring Sticta 2 days back. Surprisingly, there are so many symptoms to do with sleeplessness. I'll be sharing those symptoms with you. Okay? So 4 areas we are focusing today. Done? Now the first area I told you was, we'll be discussing about the mind. Now what exactly is Sticta mind all about? See, in Sticta you saw what is the one symptom you are already aware of? Hysteria. So who are the people who can go into hysteria? People who are very good. People who are oversensitive. People who are excited. People who are lively. All those kind of people, they go into hysteria. Now what is hysteria? Exaggerated reactions. Fine? Good. For a fine year student. I don't want the entire definition. But when you react out of proportion, when you give an exaggerated reaction, okay, I mean, you are passed in exams. Fine? Done? Okay? And you laugh or you cry or you do whatever you want. And as a human being, this is not the reaction that you should give. You are overreacting. Fine? You are over laughing or you are over doing this, all those things. So when you see somebody overreacting, fine? When you do somebody getting reacting out of proportion, we take it as hysteria. There is something called as hysterical laugh. There is something called as hysterical cry. Fine? Yeah, somebody has, somebody died, something, but you know how much you have to react and all. So you go, and you make a big scene and all those. So as a homeopath, even if you go to a funeral, I know. Even if you go to a funeral, you go to a shop, you go to a market, you are in the class, you are in the bus stand, your homeopathic mind should only think of what constitution is this, who is this person, is he arsenic? Many times in bus stand, we see, you'll be standing, fine, you are standing for half an hour, you are standing quiet. One person suddenly comes 2 minutes back and is so restless, abhi tak gaadi nahi hai, abhi tak gaadi nahi hai. Fine, when will it come? They'll keep going and asking so many people. Fine, and you know who they are. They are the constitutions who belong to a restless group. He could be aconite, he could be arsenic. We will come into the subdivision later. As a final year student, at least you should understand. Okay, now this guy is a very anxious or a restless guy. Fine? We have different kind of people like that. So your homeopathic mind should start working. Whether you are correct or not, it is secondary. It's a learning process. At least develop the attitude of looking at people as constitutions. Fine? It will be a beautiful exercise. You will not miss. Same applies to the movies. I'm not asking you don't enjoy the movie. What, sir? We are paying 300 rupees, we are sitting in the theatre and you are forcing us to think which character. So you are also tense to see which character. No. Enjoy the movie, but at the same time, enjoy the process of identifying the rubric. Or, is revengeful, is benevolent, injustice cannot support, anxiety, conscience, hell lot of rubrics you will get when you watch a movie. Fine? Slowly start developing that attitude of understanding, picking up. Right, wrong, secondary, but at least develop the attitude of picking up. So what I was trying to tell you is, Sticta is a very excited, from the image you understand, she is a very excited and very lively, very talkative female, okay? Restless, lively, excited, loquacity. They are loquacious, right? Now the beauty of Sticta loquacity. I know when I talk of loquacity, what remedies come to mind? Yeah, lachesis. Yeah, sulfur. Yes, stramonium. You got a lot of remedies, fine? Okay? Many ophidias. Okay? But what each of them talk, how each of them talk, all those things are very important. Okay? I will not go into that. If we deviate, we will be missing Sticta. But when I say loquacity, as a homeopath, you should understand what is he talking about? Okay, what is the content? Is he completing? Is he not completing? Lot of components will come up. We'll focus on Sticta. What exactly is the loquacity of Sticta? Again, due credits to Clark. I had taken this from Clark, and I again confirmed it in the repertory. See the beauty. Talks and doesn't care if anyone is listening. Okay? Blah, 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 blah. Fine? They're just talking. And the tragedy is, they're not bothered if you are listening to them, if you are enjoying the talk, if you are not enjoying the talk, they're not listening. Fine? Now, for example, you have a person in your clinic tomorrow, or you have a friend, who just keep talking, and they're not bothered if you are listening. They just want to talk. Fine? The only remedy, Sticta. See the strength of Sticta. Only remedy. There are many loquacious remedies. You have got 180 plus loquacious remedies. But the beauty of Sticta is they keep talking, and they are not bothered if you are listening to them. Fine? Now this is the situation. Okay? I mean, there are people. I don't want names. I know you are discussing which friend of yours has this particular trait. I don't want the names. But what is the beauty is, see the effectiveness of homeopathic materia medica. Their constipations, they come, they are there. Fine? So Sticta, and Dr. Clark beautifully says, very loquacious, and see the last sentence here, they can't keep their tongue still. How Clark beautifully says, see, I just read this, talking desires too. Fine? Can talk about anything and everything. Many times, which is the remedy that comes to our mind? We think of sulfur. Sulfur is one person, any damn thing. Homeopathy, allopathy, Ayurveda, Unani, this, that, yoga, meditation, anything you tell now. Sulfur will poke his nose. Boss, I know. I am the expert. I am homeopathy, I am allopathy, I am all pathis. I am here. So sulfur will always put his nose. Now Kannadalli mook tursod antide. And many times it is not required. And sulfur how they are. And sulfur is one person who doesn't care, who can talk on anything. And sulfur person is one person whose talk you will not enjoy. Because many times it will be bouncing. Why it is bouncing? Because there might also be a philosophical touch. Something, which only he understands. And he says, he'll make you make sure that you also understand. And many times you act as if you have understood. Why? Because you are afraid if you say you have not understood, he will give you one more theory, one more explanation. And if you are not Baraita, see, Baraitas may ask to sulfur, sorry, I didn't understand, please explain. But you, if you are not Baraita, or if a friend is Baraita and you have a sulfur there, and inside you are feeling happy, let him enjoy, maja nodi. So, sulfur, arsenic, phosphorus, lacasis, cannabis. Cannabis is a beautiful remedy. They are all remedies who can, talk. Cannabis can talk on anything. Mainly cannabis will talk on science. I have repeatedly been telling you this because we have cases. Until we understood cannabis talks on science, we miss many cannabis patients. They talk about planets. You'll be shocked, 4 years old boy, he knows this, that, about so many planets. And as a 48 years old man, I will not be knowing so many things. And I'm an intelligent man, I just keep my mouth shut. Because I know how many planets, which is the far, which is the small, which is red, which is violet, which is blue. All history you will have. 3 years, fat. And you'll be surprised with the enthusiasm they have about space, about science. That is cannabis. There, please don't give sulfur, don't give lacasis. Sir, he was talking. But what is he talking? That is very important. So cannabis, they talk mainly on science. Beautiful remedy. I have personally experienced in my clinic. With that confidence I am telling you, it works beautifully. Okay, so we'll get back here, and I hope you have understood the crux of Sticta. Sticta is also loquacious. Okay, but but they'll not bother if you are listening to them or not. So they can't have a control, or they can't keep their tongue still. See, that's why I've got this beautiful image taken from Google. Blah, blah, blah. It's going on. Huh? What is the feeling you have? Somebody just put something into our mouth. You have that feeling, no? Why don't you plug their mouth? Bye mucha one nimsha. Fine. So Sticta. Fine. But Sticta is not bothered if you're listening or not. Fine. That's very important. See, another very important thing. People who already have read about Sticta, they will always connect is this feeling in Sticta. What is this feeling? What is this? Huh? Okay, how can somebody lie on air? Yeah, beautiful, that's the word. Good, good. Some boy has got it right. Floating. Floating in air. Okay? So what is this? It's a delusion. Can we float? Dinesh, yeah, that's coming to a point. We can't. So it's more of a delusion. So delusion as if his body is floating in air. Okay? We have got many remedies. But something again very characteristic in Sticta is delusion as if legs are floating in air. The only remedy in our Materia Medica which has this symptom. And what is that symptom? Delusion, legs floating in air. In brackets I have written only. Then this is the only remedy. Okay? So we'll go ahead and what is this? We already know this. Overreacting. Fine? Reacting out of proportion. Okay? Hysteria. Hysterical reaction. Hysterical behavior. Fine? Many times it is unfortunately related to women. Not that men can't be hysterical, but predominantly hysteria is seen in women. It comes from the word uterus. Hysterectomy and all, you know, no? So it comes from the word uterus. Fine? And women have uterus. Fine? That's how it is related. Okay? So hysteria, what is the cause for hysteria? Hysteria after hemorrhages. Hysteria after loss of blood. Okay? After loss of blood, the person is becoming hysterical. The remedy is Sticta. Only remedy is Sticta. So it has got a lot of value. Okay? Hysteria after loss of blood. Done? So we'll quickly, before I go ahead, we'll quickly recall what we have discussed. And in the next component, we'll try to complete everything. So for students who joined late, for students who have not understood, what is it that we are trying to do here is, we are talking about a very simple and an interesting remedy, and this remedy is Sticta pulmonaris. Okay? And whenever Sticta pulmonaris comes, it should come like images in front of your mind. What is it? The sphere of action, 4 baratte. The first one is the nervous system, second is the joints, third is respiratory, and fourth is sleep. 4 areas we are going to discuss. Fine. And 2 very important ailments. One, fall, and because of fall they will have knee problems, and because of loss of loss of blood, they will have chorea or hysteria. Beautiful, good. And we spoke of mind. Mind we concentrated on excitement, loquacity, and the beauty of loquacity in Sticta is they will not wait. I mean, they will not wait, they will not bother. If you are listening or what, I will talk. ನಾನು ಮಾತಾಡ್ತೀನಿ, ನೀನು ಕೇಳಿಸ್ಕೊಂತೆ ಕೇಳಿಸ್ಕೊ, ಇಲ್ಲಾಂದರೆ ಬಿಡು, but I will keep talking. That is speciality of Sticta. Okay. And then we saw hysteria, and then we also saw delusion, as if body, more than body, legs floating. Okay. Any questions at this stage? Any questions? We'll go ahead. Ellargu artha aita? Okay. If it is clear, then we will talk of respiratory. Now, what did I tell you when I started? A remedy which affects both upper and lower respiratory tract. Affecting the upper respiratory tract, what will Sticta do? Okay, fine. What will Sticta do? So it's a beautiful, understanding. If you understand, it will fall in place. Very simple. The first very important thing is, I told you that Sticta acting on respiratory, it will cause dryness. Okay, good. We'll come to it. Now, very important for you in Sticta is, see, there is coryza. Rhinitis, coryza, discharge. Now, the discharges in Sticta gets dried very fast. There is cold, there is discharge, but this discharge is getting solidified and it is getting hard. Okay, it is getting dry. Fine. Okay. Now, this is what you need to remember, that it will form crust and they become dry. You have finished your third year ENT. So one very important condition that you can think of here, that formation of crust, rhinitis and all. What type of rhinitis? What is it? Atrophic rhinitis. Fine. You know that there will be crust. You remove that, it starts smelling and all. So indirectly I am trying to tell you that Sticta can be a very good remedy for atrophic rhinitis. Okay. Dryness, crust formation, violent sneezing and coryza. Okay. Now moving ahead. Now this is again a nice scenario or nice situation you have in Sticta. Many patients in your clinic, they come to you with the same expression. What is it? They keep blowing nose. Yeah? They keep blowing nose, but nothing comes. You are clear with the situation? Doctor, I keep clearing, I keep blowing, but I don't see anything coming. But I feel like blowing. Now why do they feel like blowing? It is because of the dryness. Okay, they feel dry, they feel there is something, but they feel like blowing, but nothing comes. It's a very important thing, remember. Any other remedies that you can relate here as a final year student? Kali bike. Okay, Kali bike, and you also have Teucrium marum verum. And you also have borax. You also have borax. Fine. See, Teucrium is a very rare remedy. I don't know how much time we have, but going back to my memories as a homeopathic student, we had a very good friend of mine who is a great practitioner today, and he had a mastery over remedies, rare remedies. In third year and final year, when any teacher would ask any question, for example, if teacher asks, what are all the remedies for polyp? The girls who were my batchmates, they would tell Kali bike and all. But this boy would say, Teucrium marum verum, in a big thing. And for many that during those days, Teucrium marum verum was a rare remedy. And all the girls would turn back, who is this man? And so this guy would take a lot of scope during those days. Fine, he's a nice practitioner today. So Teucrium, borax, Kali bike are three more remedies you can add to the list that desire to keep blowing their nose. Okay, one. And second thing, we'll go ahead. Now this, yeah, very good. Yeah, what are all the remedies? Huh? Yes, only aram triphyllum? Cinna, good. Okay, now see, being in teaching, I am surprised whenever Cinna comes, some student without our conscience will tell chamomilla. Same thing happened now. For any situation, now when Cinna comes, that's how we are trained, Cinna and chamomilla, child remedies. Same happens to Bryonia. When somebody talks of Bryonia, some girl or boy, voluntarily or involuntarily, it just slip. Restox. Fine, aap le lo ya feko, but restox. So, Cinna and aram triphyllum, beautiful remedies, two remedies. Good. Now, why in Cinna? Why do they keep boring their finger? Okay, good. So, they will have irritation. Irritation, which is because of the worms. Good. Now, why in aram triphyllum? Correct. Why? Kyun? Good. Somebody, aram triphyllum. I was very happy when you said aram triphyllum. Good. Cinna is what we all know. They have irritation. Why aram triphyllum? You know, just give some, Yeah, they keep picking lips also, agreed. Don't dig your own grave. First finish one question, then we'll go to the next. Then I'll ask you why they pick their lips. Fine? Okay. Yeah, until it bleeds. Okay, good. Chalo. Now why they keep boring their finger in the nose? Try. If it's right, good. If it is wrong, no issues. At least cultivate the habit of thinking. What is it that you have in aram triphyllum? Why the child is forced to bore his finger. See, in aram triphalum, the issue is mainly with discharges. The discharges in aram triphalum are very acrid, and that acrid discharges will irritate. It is not the worms that is irritating. The discharges in aram triphalum is acrid. Because of that acrid excoriating discharge, they feel like putting their finger into the nose, aram triphalum. Okay. Now the question, why in Sticta? Why in Sticta? Good. In Sticta they have that dry feeling. They have some discharge stuck in the nose. So Dr. Clark says, decides to put fingers in nose to clear out some gluish secretion. Glue means gum. So that coryza which has become dry, that it will be irritating. So they feel like putting the finger. So any child who puts his finger into the nose, we can't think of sinner. We need to understand why is he putting his finger into the nose. We also have a few of them, they'll be doing this. Now what is the speciality in this case? There is no cold. You understand the situation. There is no cold, but they keep doing this. How do you interpret this symptom? Very good, it's habit. Yeah. But how do you look into the repertory? Yes, good. As a final year student, how do you interpret this? Many times we have people now coming, doing all these things. So this is more of a gesture. So you will be seeing under the mind, chapter mind, gestures, keeps his fingers on the nose, something like that, keeps doing this. The remedy is stramonium. Though it is a habit, fine. And if he has other symptoms of stramonium can do wonders. So we'll get back to Sticta. Sticta is a right-sided remedy. So you see more of the right nostril getting affected. Tickling in the right nostril, and of course atrophic rhinitis, which we discussed. One more very important symptom here is, what is this? I am trying to focus on an area. Sticta will have pain. Sticta will have heaviness, root of nose. At the root of nose, they will have pain and heaviness. Sticta. Many times, in my clinic, I know, that's what I told you. I don't know much about Sticta. The beauty of teaching you students is, I also learn. That's the advantage. Fine. And I am getting paid also for that. Fine. Now the beauty here is, many times in our clinic, we mistake this situation and we prescribe a remedy. And that specific remedy that we prescribe when somebody is talking of pain here is calibike. Many times calibike does wonders. But when calibike fails, you should also remember there's another remedy, Sticta, which can do wonders. Sticta will have more of heaviness. Calibike will have more of pain. Okay? And sinusitis, beautiful remedy, calibike. Okay? But the difference in calibike and Sticta is, in calibike you will have more of stringy discharges. Okay? Here you see more of dryness. Okay? So we'll move ahead. Pain and fullness of the nose. Now we'll talk of the respiratory, lower respiratory. Now before I take up, again, same question. Any questions? Or is it clear? See, that's what I'm trying to tell you. The class should be more of a pictorial view. Fine? You need not by heart. Don't by heart Materia Medica. Understand. And thanks to Google Images, because they have made Materia so, with images, it's more interesting. And you can capture the images better. So when I talk of Sticta nose, you should get all these things. What happens systematically? Fine. It acts on the nose, causing dryness. So child bores his finger because he feels there is something stuck there. Okay? And then you also have that fullness. You also have that dryness, that inclination, that desire to keep blowing the nose. All these things you have in Sticta. Okay? So we'll talk of the respiratory. When you talk of respiratory, lower respiratory, in Sticta, you mainly have cough. cough. So cough ಏನಕ್ಕೆ ಬರುತ್ತೆ? This is what you see here. Cough which is caused from tickling in the larynx and trachea. So there is an irritation, an itchy feeling in the larynx and trachea. This will trigger the cough. A better remedy. Better remedy. Heparin is there, I don't deny. Good, more than spongia, more than Drosera. See, your answer should have depth like, as a final year student, which is other remedy which will have irritation in the throat causing cough? Huh? No problem. See, ailments, what happens? In ailments, they will hold their throat and cough because they feel cough will tear their larynx. Okay, no issues. Good, ailments. No problem. Irbodu. But that one specific remedy, that tickling and it will cause cough. Yaradu? Somebody told, no? Or I am hallucinating. It many times happens, no? You have it in your mind and you imagine, no, I had it right. Yeah, good, very good. Rumex. As a final year student, please don't forget Rumex. Irritation in the throat, cough. Cough aggravation, talking. Cough aggravation, cold air, Rumex. Beautiful. From my experience I am telling you, Rumex works. Beautifully it works. Okay. So here, tickling in the larynx or trachea giving rise to cough. What is the character of cough? Dry, loud, hard cough. Okay. Dry, loud, hard cough. This is what I have written here. Barking, hacking cough. Aggravation lying down, aggravation night, preventing sleep. Please remember this. We need this a little later. Preventing sleep. And another very important symptom, again Dr. Clark contributes, or I have taken it from Dr. Clark, cough after measles and influenza. Okay, remember this. See, these are all stalwarts they have given. And no allopathic antibiotics, no allopathic cough syrups will relieve the way our remedies relieve. Okay. Yesterday we had a case, very nice case, interesting case, of a man with cough for 15 days. And I felt very happy when one of your interns, this boy who comes to my clinic, he answered that question. I felt very nice. And what was that specialty in this man was cough single boat. Okay. Now, cough single boat, the only remedy is calcarea. Good. I am happy you got it right. So, here antibiotics, here cough syrup will not do good. A single dose of calcarea can make wonders. Okay. I have seen many patients beautifully improving with calcarea when they have this single boat cough. Don't worry about the constitution, whether they are lean, thin, all that don't worry. It's a state remedy, it's an acute remedy. So they are not fat, you go become fat and come, then they'll give calcarea. Fine. So it is an acute prescription. So I was happy, the boy sitting next to me, when I just looked at him, said, calcarea. Good. You feel nice. You feel nice. Okay. So calcarea, never miss. Never miss and take it for granted, it works. It works beautifully. Okay. So cough after measles, cough after influenza, Sticta, specific remedy. Fine, Dr. Clark. And bronchitis. Again, an indication given in Sticta, bronchitis, pain from sternum going to the spine. See, somebody with bronchitis comes to you with this concomitant symptom. Doctor, when I have difficulty in breathing, when I cough, I have pain here. Okay, fine. Now, where is this pain going? This pain right through it is entering and it is going to my spine. Remedy is Sticta again. These are all PQRS symptoms. Please remember, they can be very handy. Okay? So probably that's what I have written. Yeah, I have written it here. And one last symptom. With due respect to the religion, but what I am trying to tell you here is, there is something called as clergyman, yes good, clergyman sore throat. So what is clergyman? Clergyman meaning is a male priest who keeps talking too much. Yeah, I know, I will come to that question next. So first see, understand the meaning. If you don't know what clergyman sore throat is, Tomorrow a priest is coming in front of you sitting and is telling, doctor, I have problems. Or a person is talking too much. Okay. A preacher is talking too much. He's got hoarseness of voice. You should know what exactly the term is. Clergyman's sore throat. In Alan's keynote, there are many remedies. Now we'll come to the remedies. Phosphorus, good. Again, arum trifolium itself is a beautiful remedy. Okay. Argentum, Drosera, good. One rare remedy can you think of from your final year syllabus? One rare, not rare. See, when it becomes rare, when we don't know. Allah, when we know, it is a known remedy. When we don't know, then it is an unknown remedy. Many of the remedies in our materia medica are unknown for us. Correct? Now, because we don't know. Fine? So, the beauty here is selenium. Now, purposely I am talking of selenium because when we talk of selenium, we think only of sexual symptoms. But selenium is also a remedy which can be thought of in clergyman's sore throat. Drosera, argentum, okay, arum, phosphorus, lot of remedies. You can also add. Now, when you think of, see the beauty, when you think of sticta in clergyman's sore throat is when the mucous membrane is dry. Dryness of mucous membrane with sore throat. This combination is sticta. Every clergyman you cannot give sticta. It should have this. Okay? Hope I am clear. Fine, we'll go ahead. And we are looking at the third component of today's objective. We spoke of mind, we spoke of respiratory, we are speaking of joints. Joints only, now this is what housemaid knee. My wife was making fun of this pic. Any idea why she was making fun? Yeah, it's a manly, it's a man's leg. And generally housemaid is a female. I didn't have an eraser to remove all this, all the hair. But at the same time I did not have time. So I have retained the same picture taken from Google. Okay. So this is housemaid's knee. See, housemaid's knee means not necessary maid. Anybody who does work kneeling. So generally cleaning, swabbing and all, we kneel and do. No? So any profession where you have to kneel for a long time and then your knees gets affected, you can think of sticta. Okay. Now what is housemaid's knee? This is peripatellar bursitis. The bursa, the patellar bursa, that will go into an inflammation. Okay. So, pre-patellar bursitis, when you have shooting pain in the knee, you can think of this remedy. And red spot of inflammation, you can see this red spot here of inflammation on the affected spot, and one symptom you can contribute. Under knee, what is that one symptom? Yeah, very good. Arthritis. Knee affections after fall. Knee affections after fall, you can think of sticta. And then one last symptom here is, this also you already know. What is the other symptom? Legs delusion. Legs floating in air. That's also a symptom. Okay, we'll go ahead. Yeah. So this was about the extremities. Last thing. Sleep. See, sleep, I was surprised. There are so many things, and many things in sticta are only remedies. Only remedies there are. Okay. So sleeplessness, from what you see here. Sleeplessness after surgery. Only remedy. So surgery has been done, after which the patient is not able to sleep. We generally give passiflora, drops and all. Please, it is specifically indicated. The remedy is sticta. Another rubric I found in your repertory is, after the fracture has been reset, the bone has been fractured, fracture has been reset. After this they go into sleeplessness. Only remedy is sticta. So ailments are sleeplessness after surgery, sleeplessness after the broken bone is reset. Okay? Sticta. And sleeplessness, what is this? What did I tell you on the cough? Cough preventing sleep. See, in your repertory, a beautiful symptom that I got here was sleep disturbed in children because of cough. I will repeat this, it's a very important symptom. Many mothers come to a clinic and tell this. Doctor Sahab, last night मेरा बच्चा नहीं सोया, इतना कांपता था, not mother was disturbed, the child was disturbed coughing, okay. Sleep disturbed cough from in children, the only remedy is Sticta, okay. So very easy to cure, acute case. When cough is disturbing sleep, especially in children, Sticta, okay. And what is this? Yes, good. Ailments, I mean sleeplessness after accidents. Sleeplessness after accident. Sleeplessness after injury. Again, only remedy. Here, sleeplessness after injury, you have arnica. You also have Sticta. And what is this? The child has to be rocked. If you don't rock the child will be awake. You know, I mean, we have many kids. They have to be rocked. Once you think they have slept and you just try to put them down on the bed, they'll get up. Again, you know, you have to keep doing this. What is rocking? This to and fro movement. Again, you keep rocking, child sleeps. 3 remedies should come to your mind in this situation. One is Sticta, and the other 2. One more, Sina, very good. The other one, I told you, you make this mistake. Okay, the other one is carcinosin. Sina, carcinosin, Sticta. Child has to be rocked, otherwise child will not sleep. Okay. So the last thing is the modalities. I'll just in the end 2 minutes we'll try to revise. Hope this is clear. Hola, images. And modalities: aggravation wet weather, aggravation sudden change of temperature, amelioration open air, aggravation night, aggravation lying down, amelioration least discharges. So there is dryness, any discharge comes, they feel better. So aggravation and amelioration. Now the last important slide. If you remember China arts, I told you this. What theoretically you study, what should be the main aim of a final year student? That knowledge should be applied. Very good. That knowledge should be applied. Fine. So what is this that I am trying to talk here is the clinical application. Very good. The clinical conditions where Sticta can be thought of. This is open for you. It's a discussion part. Understanding Sticta, you tell me where can Sticta be indicated? Atrophic rhinitis, very good. Acute bronchitis, bursitis, arthritis, housemaid knee, okay, no problem. Huh? Laryngitis, yeah, good. Clergyman's sore throat, good. Opkonde. Huh? Insomnia, very good, correct. Insomnia, anything else? Hysteria, good. Delusions, confusions, huh? Okay. Chorea. So these are few things that I have got it from my understanding. Many you have covered. Cough irbodu, bronchitis, sinusitis, rhinitis, and the rest you have already covered. So this is with Sticta. Any questions related to Sticta? Okay, I mean, see, these questions are very difficult to answer. But anyway, when I asked you any questions, you have raised to us, and what I can answer, I will definitely answer. See, now the question is, why they go into sleeplessness after accident? Huh? Or surgery. This was what I was discussing with my wife yesterday. Now she also had a point there. What she was trying to tell me is, once everything is done, they are feeling sleepless. See, fracture bone is reset. Okay, fine. And there was one more thing here, no? Something happened. Yeah, after surgery, when everything is over, why do they go into sleepless mode? That is something, if you look into the mind of Sticta, they are not very anxious, they are not very fearful kind of people. Fine. But why is this happening? At this stage I can't answer. But can anybody think of any reason why Sticta after surgery is going into sleeplessness? No, I mean it's not as simple as that. Is it, see what one of your friends tries to tell is it anything to do with the medicines, anesthesia? Fine. Not everybody will go into sleeplessness. Many of you will be relieved now. Surgery over, let me sleep. But Sticta is opposite. Surgery over, let me be awake. I don't know why you want to be awake after surgery is over. No, I mean, I don't know. See, a lot of things might come up, pain, anesthesia, etc., etc. I'm not very sure. Fine, but it is there. See, then sleeplessness from pain should be there. No, under that you don't have Sticta. Yeah, correct. See, that is the thing. Sleeplessness, pains from ಒಂದು rubric ಇದೆ. In that you should have had Sticta. Sticta is not there. Sticta is specifically there after injuries or after accident. So some symptoms which are subjective or some symptoms which come up in clinical scenario, they might be little difficult to answer. Or at least it is my limitation. Today I am not able to answer. Okay, let's think. We'll see. It will come out with some answer. Apart from that, any other questions? Anything you want me to repeat? Any issues? Any doubts? All clear? Okay. If all clear, then we'll stop. Thank you.